if you want to see the reality of what we're talking about, type in Maine overdose opiates and hit images on Google and see what pops up. And you're going to see page after page after page of young people, older people, crying parents, crying siblings.
People don't always remember what you say to them, but they'll always remember how you made them feel. And they remember that part of things. They remember that somebody is concerned about their safety. Because the fact of the matter is, by the time they get to our door, they've already pissed everybody off in their lives. So just having somebody, express, some sincerity that hey, we're glad you're here, means the world to them.
Medication-assisted treatment, MAT, is truly standard of care. It's very, very tempting, I think, for a lot of people to just prescribe Suboxone, but I would argue that that is not standard of care. And it's actually a disservice to our patients. They really need to be in psychosocial counseling, and it's worth the effort to find a good counselor to work with. A patient is not in treatment if they don't have the counseling piece.
2007, 2008, all of a sudden I had this large population of young people calling for help, and they were shooting heroin and they were snorting opiates, and that was probably the toughest summer of my career, because I didn't know what to do. I didn't know how to help folks. I didn't know what the answer was. For a long time, it was an abstinence model. For a really long time, it was don't drink, don't do drugs, go to meetings, go to counseling, you'll be fine. And what we find with this population, the opiate-addicted population, is an abstinent model is not going to work. It doesn't work. Rather than, keeping people, the doctor's office, keeping people on this really long waiting list, they let us do our job. And so we started screening people, and we started doing the assessing for them. And, based on, DSM criteria, ASAM criteria, whether or not this was a person who was even appropriate for this type of treatment.
We have a good working relationship. We text, we email, we pick up the phone, and sometimes I'll just sit down and be like, what's going on with our patients? And we'll just chat over lunch or whatever. There's a lot of close communication there.
We have a clinician in this practice, well, actually in all of the practices that we work with, 2 days a week. So we coordinate our appointment times with the front desk, and clients know, they just know how that works, and they seem to really appreciate it, There are doctors and counselors who don't know each other yet that could get to know each other, that could be awesome with each other. They just don't know how to do that yet. And maybe they just need a little bit of help figuring that out. Or maybe they didn't know that resource was in their community, and they could be awesome, but they don't know each other. They just maybe need a little bit of help. When we are talking to our patients, clients, about the program and how we do things, we talk to them about the safety. This is a safety issue. We're going to talk with the doc, because we want to provide you the best care possible. We're going to do urine drug screens. This is a safety issue. You could be mixing medications or drugs that you are not aware could potentially kill you. They are so much more willing to accept that. They understand that.
There's never, ever any judgment in my office, ever. This is not a moral disorder. This is not a choice.
You really get to see people change, their lives, and what a person who might be what you would consider the most unlikely candidate. And the next thing you know, they're in school earning a degree. It is amazing.
This is a bigger problem than a doctor can fix. This is a bigger problem than a counselor can fix or the police can fix. It's a community problem. This is a social problem. And it's going to take people from all walks of life to really make an impact. Our job is easy because a good counselor will do all the heavy lifting for us. So when we get a patient a new referral, all the hard work's been done. They've been diagnosed with an opioid use disorder. The treatment plan's kind of in place from a psychosocial standpoint. I'll tell you, there is nothing like this practice. You will sit down for 20 minutes and talk with a person whose life will be directly changed for the better for the rest of their lives. And it has a ripple effect. You're going to help their kids, you're going to help their parents, their brothers, their sisters, their employers. And you're sitting back and you're looking at it and you're like, all I did was prescribe Suboxone, right?
No, but if I may, that's not all you did, because so often one of the things that, patients say to me, I say, how'd it go with the doc? Like, how'd it go with Dr. Leighton? And so often with all of the physicians that we work with that prescribe, that client will say to me, I've never had a doctor talk to me like a real person, like they did.
Because guess what? They are real people.
It's amazing.
They are. They're real people. And I've told everybody around the state, I am at 647-2311. If you have a question about anything, give me a call.